So if you have distal radial metaphyseal fractures, treat with cross K wires. If you have mid-shaft fractures, it's easy to pass elastic nail. But if you have a junctional fracture, if you pass a K wire, it misses because this is a very narrow portion. So very difficult to go through it. If you pass elastic nail, you get a very narrow hole distally. And we've seen many cases where it's gone into a malunion or loses its length. And that's why this approach in this patient, me and Mandar treated together, a doctor's child who came with this issue. And then we tried close reduction and then tried putting cross K wire. It didn't just work. And what we did then in that patient is to put a wire proximal and distal and use those wires to get it into an acceptable alignment. And having done that, then tried passing a cross K wire. And you can see that this is application of a external Jess fixator, following which we attached a distractor, loosened the cams, attached distractor and distracted, and this fell in place. And we use this just to maintain it. At around 4 weeks, this healed well, removed the fixator, put her in a functional brace, and this is her at 2 months, showing good union, length, and everything looks fine. This was one more patient which I had done a long time back in 2018. A similar patient, again, I don't know why junctional fractures happen to doctors' children or grandchildren, but this was again managed in a similar way. That time we had small shank spins and a small AO fixator, so that's how it was managed. And then 1 month follow-up, remote fixator, put him in a plaster, and that's the follow-up. So it's a challenging fracture, and just a small note to show how a simple fixator can make your life easy. Thank you.